The relatively short shelf life of AstraZeneca's COVID-19 vaccine has complicated the rollout to the world's poorest nations. That's according to officials and internal World Health Organization documents viewed by Reuters. It is the latest headache to plague the COVAX vaccine sharing project, co-led by the WHO and aimed at getting shots to the world's neediest people. According to COVAX data and officials, the problem with a short shelf life largely concerns AstraZeneca, COVAX's second biggest supplier after Pfizer. Many vaccines are arriving with only a few months, sometimes weeks, before their use-by date. Some countries have had to destroy expired doses, including Nigeria, which dumped up to 1 million AstraZeneca vaccines in November. 2.5 months of shelf life is the minimum duration African countries reckon they need to administer the shots. But AstraZeneca said since the start of the global rollout, more than 250 million of its shots left factories with less than 2.5 months before expiry. Gavi, the non-profit that co-runs COVAX alongside the WHO, said about 30 million AstraZeneca shots were rejected or deferred last year by poor nations. That amounts to a quarter of AstraZeneca donated shots via COVAX. Many were later reassigned to other countries, Gavi added, noting that more than 95% of them were AstraZeneca. It did not say where to. Other than short shelf life, COVAX's complex system to assign doses to countries, donor requests to deliver them to selected nations, and quality checks often eat into the vaccine's short life. Millions of Moderna and Pfizer vaccines could also go wasted, some African countries warned in the WHO document. The problem has been often linked to low vaccine uptake and insufficient cold chain equipment to distribute these shots in remote regions. Gavi said it has encouraged AstraZeneca to apply to the WHO for an extension of the expiration date. But talks have not led yet to a formal application.